Hi everybody, Neil Kravitz here. Hope you're enjoying these daily clinical pearls. I am often asked how I go about orthodontic treatment of a patient with Down syndrome, and I have a little bit of a different perspective. I've treated a large number of Down syndrome patients, and my suggestion is to be judicious. I think there is very minimal orthodontic benefit for the majority of patients. In fact, because you're dealing with an open bite and macroglossia and a protrusive tongue thrust, or at least protrusive tongue pressure, as you orthodontically tip the teeth back and the tongue continuously pushes the teeth forward, you get this like paper clip effect. And I think all that happens is you get minimal orthodontic gain and a lot of root resorption. So I always tell patients, really, if we can avoid orthodontic treatment, that is my preference. And even if you are able to achieve a decent orthodontic result, it's very hard to hold that position because of the protrusive tongue thrust. There is some benefit because there's usually concomitant grinding and clenching on the teeth, so Invisalign is a great option if you are going to treat. A little bit of a secondary pearl here. Sometimes a staff member who is not accustomed to treating a Down patient will say, what's the best way to kind of go about my behavior or their behavior? I always say, look at the sibling, because you'll see so much love in how that Down patient is treated by their big brother or big sister, and that's exactly how you need to be as the technician or the orthodontist. So always look at the sibling and the love that sibling has and the care that sibling is doing for the way you need to behave as the doctor or the technician. I hope you enjoyed this pearl. I know it's a little bit different. I'm just very judicious with treating patients with Down syndrome, and I really try to tell the family if there's another investment that could be better, that's where I'd like them to spend their money. So I hope you enjoyed this pearl. I'll see you guys tomorrow for another clinical pearl.